When workplace injuries happen, give your employees the support and direction they need to receive the most appropriate injury care with the 24/7 Injury Helpline powered by Medcor. With the helpline, your injured worker, along with their supervisor, can call and talk to a specially trained triage advocate moments after a workplace injury occurs. Using state-of-the-art software and patented methods, the triage advocate will recommend the most appropriate path of care for the injured worker. You'll speak with Medcor's specially trained nurses and support staff who will provide you clear, specific direction on what comes next. Here's how it works. For potentially life-threatening situations, 911 should always be called. Life-threatening conditions include, but are not limited to, choking, unconsciousness, disorientation, severe bleeding, difficulty or inability to walk, hot, dry skin, seizures or convulsions, difficulty breathing, chest pain or discomfort, heavy sweating, severe abdominal pain, or any other problem you feel may be an emergency. For other situations, when employees are injured at work, the helpline is called. When a supervisor is available, the supervisor will call the designated helpline number from an area that safeguards the injured worker's privacy. Otherwise, the injured worker will call.
Medcor Online, this is Kathy, registered nurse. How may I help you?
At the start of the call, the triage advocate will ask the supervisor for basic information about the injured worker, their employer and location, and information about the injury. Then, the injured worker will speak to the triage advocate. Using proprietary algorithms, the triage advocate will assess the injury's severity through simple questions and will recommend the most appropriate course of action. The helpline operates 24/7, so it's always available. There's no need to download special software, and no time spent waiting for a call back. This proven post-injury process gives your injured worker decision support for the most appropriate care. The triage advocate may recommend resolving the health concern on-site with basic first aid. Then, self-care instructions are emailed to the employee and work location. For injuries that are more serious, the triage advocate will refer the injured worker to appropriate in-network providers. In some states, employers can pre-select providers to ensure their injured workers see an in-network healthcare professional. The triage advocate will advise the provider that an injured worker may be coming in for treatment. The helpline can also refer the injured worker to a telemedicine visit when appropriate, and a video-enabled computer is available to avoid time spent driving and sitting in waiting rooms. If self-care is recommended but the injured worker experiences a change in symptoms, they are always welcome to call the helpline back to receive further guidance. The helpline provides translators in over 200 languages, and all calls are recorded for quality assurance. At the conclusion of the call, the advocate will give clear recommendations to the injured worker and their supervisor, including basic self-care instructions, provider address, and operation hours. If the employer elects, an incident alert is emailed via a secure link to the designated company managers and location recipients minutes after the call concludes. When appropriate, a partially completed first report of injury form is also provided. Ensure your injured workers are on the most appropriate path of care the moment an injury occurs with the 24/7 Injury Helpline powered by Medcor.